Hello and welcome to this talk. We're going to cover some of the basics of hyperbaric oxygen therapy today. Who am I? My name is Greg Brown. I'm the medical director of Wellington Hyperbarics. I gained a Bachelor of Medicine and Bachelor of Surgery with honours from the University of Sheffield in the UK in 2005. I am a vocationally registered GP and I've worked in a few different places in New Zealand. I was a medical officer in the Defence Force in and out of uniform for a number of years, and since mid-2022 I've been the medical director here. Why am I involved in hyperbaric oxygen therapy? Well, there's a bit of a push and a bit of a pull. I think the push is a sense of frustration at some of the principles underlying traditional medical practice. I think chronic disease management has its issues. I think a lot of the drugs that we use lack a decent evidence base that we can trust. And fundamentally, the system is really not about making people well. It's about managing their disease. Hyperbarics, in contrast, is an incredibly exciting field of medicine. People do get better that can't be well treated by conventional medicine. A lot of the time, the evidence base is growing. It's strong. It's non-pharmaceutical. And a completely different paradigm. So what is hyperbaric oxygen therapy, or HBOT as we sometimes shorten it to? Essentially, it's a dual drug therapy. It involves the application of pressure at levels higher than atmospheric pressure, and it involves the administration of supplemental oxygen. These two things do actually slightly different effects in the body. Now, there are a variety of therapies that are referred to as hyperbaric. Okay, on the one hand, we've got what is sometimes referred to as mild HBOT. So this is delivered in soft shell, usually welded canvas bags, and it's capable of delivering pressures of up to about 1.3 atmospheres. On the other side, we've got hospital grade chambers that look a little bit like a submarine. They are capable of doing quite high pressures, often for the treatment of dive injuries and of other indications for hyperbaric therapy that we don't touch. Now, we sit somewhere between these two. Okay, so we are delivering what we think is the Goldilocks zone of around about 2 atmospheres, so twice atmospheric pressure. We are doing so in hard shell chambers, and we think that the safety profile of these is better than canvas bags. We think that the computerization and the automation of modern chambers means that this can be administered in the community, and it doesn't have to be in the hospital setting. Okay. And we think that the evidence base actually sits within this range of 1.5 to 2.4 atmospheres. Our chambers look like this. We've got a 2-seat and a 5-seat in Wellington. We also have single place chambers elsewhere in the country, including Nelson and Palmerston North. And as you can see, they're quite large. They're not especially claustrophobic. The seats are comfortable. It's quite a pleasant experience being in them. This little video here just shows what the chambers look like on the inside. How does hyperbaric oxygen therapy work? There's certainly an immediate effect from increased oxygenation, but in terms of the longer term effects that the therapy achieves, this really divides into 3 main areas, which are diagrammed here. Firstly, we've got new blood vessel growth, angiogenesis. Okay. Secondly, we have the production of increased numbers of circulating stem cells. And thirdly, we have a reduction in inflammation, which is principally achieved through epigenetic changes, so turning on and off of genes that are there in the first place. Fundamentally, what hyperbarics does is it heals wounds, and it actually doesn't matter where that wound is. That wound can be external and visible, like a leg ulcer, or it can be internal, like a stroke. It works just the same. From a wound healing perspective, where you've got a blockage or poor circulation, HBOT delivers a lot of oxygen that gets dissolved directly in the blood plasma. This then bypasses any blockages because it can flow past obstructions and it can oxygenate tissues that are struggling for lack of oxygenation. However, in addition to that, as you see here, there is the stimulation of new blood vessel growth that will actually grow around that blockage and restore circulation. And this is well established. There's a whole bunch of pictures. I don't take any credit for these, but there are lots and lots of cases online where non-healing ulcers have been radically helped by hyperbarics, and we have done some of this work ourselves. A few other indications. Our sporting culture in New Zealand results in about 36,000 traumatic brain injuries a year, and many of those will have some degree of dysfunction that persists, and in particular we see a number of people with persistent post-concussion syndrome that may then struggle with cognition, memory, and may actually have their employment prospects limited by the injury that they've sustained. Now, hyperbaric oxygen can substantially improve these patients' lives, and it can do so many years after the fact. There's a paper here that demonstrates that. A very important systematic review was published last year in the States that showed that hyperbarics was top grade evidence behind it for traumatic brain injury, and this is now accepted for insurance purposes in America. I mentioned strokes briefly earlier. Well, if you have a stroke, you have an area of brain necrosis, you have dead tissue. However, around that area of dead tissue, there is an area of metabolically dysregulated tissue that's called the ischemic penumbra. That can be reperfused substantially by hyperbarics, and that can actually limit the extent of the permanent dysfunction that people who've had strokes will suffer. The top right diagram there is from a SPECT scan, which is a scan of brain perfusion, so it's showing how much blood is getting to various areas of the brain. Darker colours like the green at the top there is lower levels of flow. Brighter colours like yellow is improved flow. What that shows in this particular case is that hyperbarics has improved the blood flow to that area of the brain that was under perfused. We're also seeing the effects of the COVID virus and associated interventions. We're seeing people with long COVID type syndromes. It's very early days, however, there are some studies now that are showing a benefit, and we're talking small numbers, so watch this space. In conclusion, hyperbarics is a growing, safe, exciting area of medicine that can often do things that conventional medicine can't. We are offering this therapy throughout New Zealand, and if you're interested in that, please visit hbot.kiwi.